I was the first doctor, actually first team that entered as a primary care because I'm a family physician. So we had the opportunity to work in different conditions. We work in European Gaza hospital. We work in the outpatient settings in clinics. We also worked in Emirati hospital, that's the maternity hospital. So we also worked in a school, Darul Fadila school. That was a school, but where thousands of refugees were taking the place. And then there we were seeing like 300 patients every single day. So actually, the healthcare structures, as all of us we know, has been actively targeted. The attacks on the healthcare structures, on the hospitals, killing of the healthcare workers is unprecedented. It is due to the only heroic actions of the Palestinian doctors that the healthcare is somewhat functional in Gaza Strip now. And I want to reiterate that I have never seen in my life the passion, the grace, the dignity that the healthcare of Palestine showed to me. So let me just show some pictures. I have shared some pictures of my current team, actually Sister Haifa team when I went. So this they have shared this screen for me that you can see that the hospitals are clearly, this is the corridor on the left side of my screens. This is the corridor of the hospital. People are living in the staircase. Only very small place actually I've seen in European Gaza hospital, the same scenario. That it's very small space, people are cramped, they are living in the small spaces where we can only space to sit, and they are living there for months with their small children. I have lost count of how many children I have seen that with the bullet-related injuries, shrapnel injuries. One young boy that we saw who had shrapnel entered into the brain. I met him in European Gaza hospital, and he had complete paraplegia. We met 7-year-old girl that whose 70% of the body surface area got burned. And when I met her in European Gaza hospital, there was the nurse who was changing the dressing of this girl. She was crying when she was describing that how much pain herself she goes through and how much pain this 7-year-old girl goes through, because there was no pain medication available. There was no antibiotic creams available. And when I met that girl, she had internal organ injuries also. So only she was talking to us in a small, weak noise. And she was asking for water. So it was very heartbreaking to see. We saw a 8-year-old boy who had not eaten for 4 days. So back in February, we were seeing, now we have seen the full-fledged famine, especially in northern Gaza. Back in February, we saw that people were starting, every person almost I met in Gaza, it was hungry. Doctors, nurses, elderly people, pregnant women, the children's, everybody was hungry. And I want to point out here, before I tell you the story of this girl, Gaza is a very difficult place for a pregnant woman to be. And Sister Haifa will tell you more about it. But we are seeing that the numbers that we are seeing, the stats, 33,000 or 40,000, I don't know what's the stats in the number of deaths in Gaza. Actually, the actual number is way more than that, because we know that lots of pregnant women, when they are malnourished, so they are suffering from iron deficiency anemia. When they are, and most common cause of postpartum hemorrhage is iron deficiency anemia. So when they are delivering in the tents, they are dying quietly, actually, during the childbirth. And Sister Haifa will tell you more about it. So I want to tell you about this girl, actually. So the left side, the initial picture, her story got viral in the social media. So she was living in northern Gaza, and where her house was bombed, and both of her parents died, and she lost all of her siblings also, and she lost her legs. So she's crying in this video that I want my legs back. So I met, her name is Razan. I met Razan actually in Rafah 4 months later, while she was living on the back of the hospital where I was working in Tal al-Sultan area. And look at that, mashallah, Razan is very resilient, and she was smiling when I met her. So she's living with her aunt right now in a makeshift tent. But I want to tell you, there are countless Razan in Gaza right now. So yeah, these are the pictures of the few children I met in European hospital. On the left side, this baby, she's a 40-day-old baby. She has a permanent brain damage due to the shrapnel injuries. And both of her parents were in ICU, and she lost her twin baby sister when her house was bombed. So this guy, in the middle, this is Adhan. So shrapnel entered into his brain. So he has paraplegia and aphasia. He was literally lying down as a vegetable on the bed of the hospital. Then there is, on the right side of my screen, there's a young boy, Abdullah, who had bullet injuries to his brain. And on the bottom, there's that 7-year-old girl I was telling you that who has the burn injuries. So I want to tell you about Riham I met in European hospital. So Riham was living in northern Gaza when her house was bombed. She lost one of her eye because shrapnel went into her eye. She has a globe rupture. She lost one of her arm and both of her legs below hips, and all of her children. When I met Rehan, honestly, I did not have any words. What I tell her, one of the journalists asked me that how many children she had. So I said that I do not know. I did not ask her. So Riham was stoic and a prime example of Palestinian resistance we have all come to know and admire. Yes, but she's still a human and a mother. And when after coming back, I was reflecting and I wonder that what prayers she makes when she's alone. I also wonder if she complains to Allah subhanahu wa ta'ala about us, about the world that has turned its back on Palestine and has allowed these atrocities to continue in full view for the last 6 months. So if even there's a ceasefire today, and we hope and pray, inshallah, it will happen soon, yet this war is going to set the survivors, adults and children, to endure a lifetime of harmful developmental, psychological, and medical consequences. We pray that Allah subhanahu wa ta'ala makes it easy for them. But let me tell you one thing with my personal experience, and my team can share it, that despite the horrors that the people are facing, the people of Palestine, they continue to rely on Allah subhanahu wa ta'ala. They are extremely grateful, resilient, and looking forward to a better future, inshallah. They are counting on us now not to turn our backs on them. And we must continue to do everything in our capacity to do whatever we can do for people of Gaza. So while I was there on the ground, I spoke to lots of people. I was talking to a psychologist one day and about the affairs of the people of Gaza. And he mentioned that the people of Gaza, alhamdulillah, they are very strong. And but they're facing a war that unlike our world has seen before. But until when? There is only that much that a person can see so many dying children and a person can handle on the daily basis. So people are not worried about themselves, actually. Whenever I was talking to them, they are worried about their children, their kids. I was speaking to someone one day and they were telling us that don't worry about us, we are good, but take care of our children because they do not deserve any of this. They want to be happy, they want to live, they want to have friends, and they want to play, they want to go and sleep at night without bombs falling besides them. So I will cut it short because I want you to hear from our team. I want to tell you a little bit about that. So our teams are working. So we were working in coalition with other organizations until now. Alhamdulillah Rabbil Alameen. So we are directly working with WHO now. Our next team is going independently now. And we are working with UN and Gaza Ministry of Health. And we are trying to send volunteer physicians every 2 weeks. So when we send physicians, the aim is to take lots of medical supplies. So we rent big buses and we put 3-4 physicians in, then rest of the bus we fill with medical supplies and surgical supplies, anesthesia, formulas, whatever is available. And so these are some of the medical supplies. And we, with the large ship team, we were able to take large amount of insulins, the anesthesia medications. So I want to tell you that since in the last actually couple of months since I got back, we have opened hospitals. So we have opened 3 medical clinics in Gaza Strip, 1 in central area, 2 in the northern area, and we're in the process of opening the 4th medical clinic in the northern area. And we are trying to fill in the gaps to manage chronic diseases and post-op infections. On the top of that, we have hired, actually, let me just see if I can take the next screen. So we have hired bought a van also to make it a mobile clinic. So 1 nurse, 1 doctor, and 1 staff, they are going to the tents because there's no fuel in Gaza. So people do not have any means to get to the hospital. And if they get to the hospital, hospitals are out of capacity. So they are trying to go to the hospital. They are triaging them. They're finding out that who needs the wound care, who needs to go to the hospital. So they're transporting people to the hospital. But our last team work in Al-Najjar Hospital also. And there's no ICU in Al-Najjar Hospital, and it's in Khan Yunis area. So we have pledged, Humanitarian Auxilium is building a 5-bed ICU hospital in Najjar because hospital is beyond capacity all over. So besides that, before I actually, let me just show you we are doing the food distribution also, but we have discussed with Ministry of Health, with the local Palestinian doctors, that what else we can do. They said that the need is to open a wound care clinic. So we have opened 2 wound care clinics actually in Rafah right now, where the majority of the people are living. And we have opened 2 trauma stabilization centers, and we are in the process of opening 2 more in the central and northern areas right now. So I want to share the cost of the 1 trauma stabilization. So what is trauma stabilization center? So there's a lot of people who have no means to get there, and there's a lot of trauma. There's no beds in the hospitals, and the team will show you how they are treating people in the emergency, in the hospitals, and the ground. So we are having surgeons, we are having wound care people in this trauma, we are stabilizing them, triaging them, and then we will see that wherever we can do it. But eventually, actually, goal is to make a field hospital there. In the last week, the Red Crescent Hospital and the International Red Crescent people, they were in the ground. Ministry of Health, they have visited our trauma stabilization center, and they were very impressed. So inshallah, we are planning to open more. The cost of 1 trauma stabilization center for 6 months is $80,000. Cost of 4 is $320,000 US. So this is I'm putting it down here, that we need to have, we have acquired 3 more sites now. So total of 4 trauma stabilization center, and Humanitarian Auxilium teams, we have hired local doctors now. They are overseeing the construction and making sure that we have the right equipment there and the staffing of that. So this is our information. And I want to tell you, and Sister Haifa, Brother Jawad, and Brother Omar will tell you more about it. I will take a couple of minutes before I leave about people of Gaza that personally has affected me. The people of Gaza, I have seen that their iman was unshaken. The people are very strong, they are resilient. And when I was going there, people were saying, oh, Fazia, do not go there because you will get infections there, and then it will be hard to eat. But honestly speaking, I have seen that there was sakina in the air, in the streets of Gaza. There I felt that I heard the verses of Surah Al-Imran in the streets of Gaza, and I saw their manifestations on their faces, on their sujood, or when they were raising their hands and they were praying to Allah subhanahu wa ta'ala. I was thinking that I have gone to help people of Gaza, but actually they have helped me. They have increased my faith. They have increased my iman. And I know that how sabr, I think, honestly speaking, I could never imagine the more clear example of the concept of sabr that I have seen in people of Gaza. I will leave now because I want to, in the respect of time, I want to give times to my colleagues. Thank you so much for inviting me, and I will be here for question and answers, inshallah.
No, go ahead. Huh? Yeah, they cut her. We want to continue here. Just a comment, we are on ISCN YouTube also, so if you want to let your families know at home.
Assalamu alaikum. I think for the rest of the talk right now, we're going to do strictly probably a Q&A from the audience, just so you guys get to meet us. Before I start, I want to just, before I do that, I literally will only take 10 seconds of your time and just read a text message that was just sent to me less than an hour ago. It's what just happened an hour ago. Assalamu alaikum. Yesterday, they bombed the masjid close by Asr time. This is at the European hospital. Not the closest masjid to the hospital, but the one right after it. It was more of a sound fire bomb where it created a lot of shrapnel and noise and shockwave. Of course, we didn't know it was time, and we all thought it was going to be a mass casualty event. There was some bad burn patient that yesterday from that, his arms were burned, second-degree burns, almost completely circumferential burn. I wasn't there, but Dr. Muhammad was there, and apparently the kid was absolutely screaming in pain from the treatment received in the ER. We had a burn doc on the team, and he went to go get some cream for him, but unfortunately, by the time he came back, the other international doctors from Fajr Scientific had already sent that kid home. Definitely, that kid had poor care due to the nature of the incident, as they wanted to get rid of as many people as possible, as quickly as possible. If that patient had come in an American hospital in general, you may, no need to treat him right away with debridement. You could keep him under cool water for 15 plus minutes, which I don't have any idea how they would do that at this hospital. 2, you probably would have waited until things were calmer and could have treated under conscious sedation. 3, circumferential burns are not to be sent home so quickly. Definitely not trying to put anyone down. Decisions have to be made quickly in these mass casualty events that are not just in the best interest of the patient, but also in the best interest of other patients, which is why it is important to bring only the most qualified and experienced people. This is sent from my brother, Omar Sabha. He's there right now, and he's a wound care doctor. This is his second tour over there. So what I always thought Aqsa Hospital is needed more, but apparently it's spreading down to Rafah. Anyway, I just speak on behalf of us 4 doctors, these 3 doctors and me. We are just going to open it up for Q&A in order to preserve and get to know this community much better. So if you have any questions, please raise your hands. Do you need the mic or just you can speak? Yeah.
I'm just kind of trying to get myself situated there. How do you make it into Gaza?
So, all of us, I'm not sure what team you went with. GLIA, okay. So there's teams, there are organizations that are, registered as emergency medical teams with the United Nations WHO. So us 3, we went with Humanity Auxilium, what Dr. Fawzi was talking about. You apply ahead of time, and we submit all of our paperwork, passports, IDs, all that stuff. It gets approved by the Israelis, the Egyptians, and the Palestinians. Everything has to be approved ahead of time. Once you're given the A-OK, you know what date you're going to enter and what date you're going to leave, and there's no changing that. So even if you get injured while you're there, like they said, the soonest they can get you out is about 48 hours. So for some reason, you can only enter or leave Gaza on Mondays or Wednesdays. So we were told we were going to get in April 1st, and we're going to Monday, April 1st, and we'll leave Wednesday, April 11th. So essentially what we did is we fly into Cairo. We have a meeting with the WHO, UN. They lay down the ground rules. And then that Monday we pray Fajr, head to the border. You know, the border itself going to the border was like a 12 to 13 hour trip. And then at the border, we're there for like another 3 or 4 hours and going through our stuff. But like I said, everything is approved ahead of time. So it's, like I said, you can't just leave whenever you want. You know when you're going to enter and when you're going to leave, and it's only through certain teams.
Any other questions?
So what is the best possible way that we can help? Like, is there, like, you know, the aid is being blocked and all that. Is there any way that we can help in a massive, and not just like in little individual items, but like as a community and as a group? What can we do?
Assalamu alaikum. Bismillah, alhamdulillah, wa salatu wa salam ala rasulillah. There's so many ways we can help. Not everybody can go, obviously. If you are in a medical team, in a medical profession, then absolutely they are in need. There is a lot of need for, we all have talked about that, definitely dua here. I'll come to the last most important one for us living here. They definitely need financial help. It's not easy to send it, but there is some, just today I received it actually. There's one organization run by an imam here in Southern California who has connections inside Gaza, and I was told the money is reaching. The list of the orphans there that I saw with my own eyes were close to 1,000. That's documented. They lost one father or one mother or both. I'm going to say something may be a little bit different from what you have heard. The best way to help these people is to be a good Muslim here. We all need to go back to Allah subhanahu wa ta'ala. What else Allah will send us to change? It could be one of your du'as that will change things. What you are seeing now from what's happening the last week, or 2 weeks almost now, with the students. As I went and saw, and I was in Washington, D.C. last week, and I went to the UCI, came to my mind the following, the dua of the people of Gaza. Because we were in the last nights of Ramadan there, and we prayed tahajjud with them. Their dua, coming not only from the heart because they are living the tragedy, but these people are close to Allah. The Quran like that, the dua like that. There is bombing and they are up for Fajr. Nobody wake them up. So you never know. Each one of us, young and old, we need to change. أَلَمْ يَأْنِ الَّذِينَ آمَنُوا أَن تَخْشَعَ قُلُوبُهُم لِذِكْرِ اللَّهِ. Hasn't time come yet for the believers? And Allah sent this to the Sahaba in Medina, almost at the end of the time of Medina, because they just had more comfort. Isn't time has come for us to change and go back to Allah? Ramadan is done, but we need to be the same people of Ramadan. So the dua, going back to Allah, stay away from sins as community, help by getting closer to Allah. If you can physically help, that's absolutely. All the pictures, by the way, what you post online, they see it. I received from them, and I think you too, is all the children that we met in the hospital had made a ban in Arabic and English, thanking the students in the United States. One of the boys, I know him personally, I met him, you know him, Muhammad. So there is a lot to do, because normally what people happen, and I've seen, this is like my 7th talk since I came back, everybody wants to go. But if Allah doesn't want you to go, or He's not allowing you to go, doesn't mean you can't do anything else. And I love the question. So, summary, get closer to Allah, change, dua. If you can send money, absolutely. Speak up about it. Speak up. It's never too late, it's never too long. They're still suffering. Talk about it to your colleagues, especially the youth. It's the younger generation of this country will change it. And keep talking about it, and keep asking Allah sincerely, and never give hope. Never give up hope. Never, even if it's going to be another 2 or 3 years. We have no idea how this will end, and they don't know. I received a message, I wish I can play it. It's in Arabic this morning. Literally, the man, Abu Musa, you all know, he sent me a message, says, Doctora, don't worry about us. We don't know what will happen, but we are fine. This morning. And if you steps from the hospital, they bombed the house, full of people, but Allah did not allow the bomb to explode. Subhanallah. So that's what I will say to everybody.
Assalamu alaikum. So I read that there are among the casualties there are like 400 medical professionals, like Palestinians, that were killed by Israelis. And also we read recently about Dr. Al-Barshi, right, who died or killed, Allahu A'lam, in an Israeli prison. So can you talk more about like how the Israelis are targeting the medical professionals, specifically among the Palestinians in Gaza?
So yeah, you know, it's definitely something that's happening. You know, they're targeting physicians, healthcare workers, professors, teachers, policemen. You know, we saw the evidence of it, you know, the first day we arrived. The director of the hospital, I can't remember his name, Dr. Khalid, but when we arrived at the hospital, April 1st, all the surgeons were praying Tarawih, so we joined them, and then we sat with them afterwards. And the head of the hospital, I was kind of noticing he was kind of sitting a little kind of awkward. And the guy sitting next to me told me that just a week ago, his house was bombed. He lost both his daughters and his wife. And from the explosion, he got, you know, thrown to the wall and he hurt his back. But, you know, he was at work the next day, you know. There's 12 orthopedic surgeons there in that hospital. They've come from different hospitals because their hospitals were destroyed, but all of them live there. They live on the hospital campus. Either one, because their house has been destroyed, or two, they're just, they know they're being targeted, so they don't want to go home. So it's definitely happening there. And you know, it's something that crossed our minds too, you know, just because we were going there. You know, we were always thinking we would be safe just because we're, you know, American citizens, but you know, while we were there, the World Health Kitchen thing happened, you know, so, and those were Europeans, Americans, and Canadians. So they're definitely targeting them, but you know, none of them are taking days off. They're all still showing up to work every day. None of them have been paid, and they're still working day and night at the hospital just because they're there to serve their people.
I have a question for Brother Omar. You were in the Marine, so you know the ballistics of bullets and stuff like that. And you shared in the masjid that what they're doing to the kids. You could share.
Yeah, so many times, I'm gonna hijack your story. The first patient that we saw is a family of 4 kids, 8-year-old girl and her 3 other sisters. We saw this many times, and they were walking in the street, one died, one got shot in the arm, upper right arm, and the other 2 sisters got shot in the leg. The patient that got shot in their right arm, they had to amputate it right away. And the one that got shot in the leg, there was a vascular surgeon on our team. He was able to reconstruct the artery and save her leg. And then the other one they got external fixation and they saved her leg. The thing I want to point out is that the bullets, the rounds that they're getting shot with, they're not just normal bullets. They're very accurate. They don't miss. It's like playing a video game. And they are targeting limbs. Their number one goal is to maim and disfigure. So many times we've treated patients that got shot in the right hand and the left leg. So many times. There's a video of me sawing off the patient's left leg because it was infected and dead. He already had an amputation at the hip. And I'm over there, after I sawed it off, I am filing it down so we can close the back up. But that patient lost both legs and his right hand. And his main nurse was his brother-in-law. Now, just to paint this picture to you guys, imagine your brother-in-law is your main nurse, and he gets to see your private parts every single day. As healthcare professionals, you know, we see private parts and we're immune to it because it's science for us, it's medical, right? But as a patient, it's kind of like humiliating a little bit. It's not dignified. And it's even worse when it's your brother-in-law. Think about that. So these disfigurement and this maiming is not just going on, it's for long-term impact. Because you can't walk, you can't be on a wheelchair, so you're completely dependent on a family member, and it's always a constant reminder of what happened to you. So there's no accidental anything when it comes to drone attacks. They know what they're hitting. 2 days before we got there, there was an attack 50 feet from the main entrance of the ER, and is on the hospital compound. And that was a targeted drone attack that killed the imam of the masjid that was across the street. So when they tell you it was collateral damage, that's baloney. There's no collateral damage. If it's a drone attack, these rounds they're very accurate, and they do what their intended purpose is.
Actually add something to that. So, I'm an orthopedic surgeon by training. I do hand surgery now, but my residency was doing in orthopedics, and it was in Detroit. So I would see gunshot wounds all the time, We'd see the 9mm entry-exit wounds. They're small. A lot of times you don't even have to suture them closed, But this first patient he was talking about, she was 8 years old, and that will hit close to all of us because we all have daughters, I have an 8-year-old daughter, Jannah, and this girl just, she was 8 years old. When I saw her, I saw my daughter, But whatever they shot her with literally exploded her arm. I've never seen anything like that. So it really makes you question what caliber bullet they're using or what kind of bullets they're using, because that's not the type of gunshots I was experienced when I was in training. Like I said, they were small entry, exit, very minimal in terms of the wounds. But this one, it looked like they put her arm into just some type of meat grinder, It was just so traumatic. There was no saving that arm. So, like he said, they're targeted attacks, and they're shooting kids, and they're shooting them with massive caliber bullets.
Any questions?
Oh, I can just speak up.
Okay, go ahead.
So for medical students and other healthcare professionals and training, what can we do during our education and training to sort of prepare us and help us contribute on missions like these?
That's a great question. And do you want to say something?
I don't know if I heard it well. Can you repeat it?
His question was, for medical students, what do you recommend for training?
Gaza should not change what you want to train for, right? Because I don't think Dr. Jawad, when he went to orthopedics, he was thinking, well, when I was doing OBGYN, you do what pleases Allah, and you do what you think you will do the best. But even family medicine, with us, were actually 2 internists and 1 ER physician. Gaza should not change my decisions of dunya. This is how I look at it. And we've been living it for a month since we came back. Gaza should change my way I look at dunya and my akhirah. And what happened to them could happen to anybody. Because they showed us, and many of us saw that, literally before and after, including the hospital. The hospital before was so much remind me, we are in Corona, and I work in Corona Hospital. It's so much like Corona Hospital. It's also 2 stories, same. And they showed us. Things can change, and this is how Allah subhanahu wa ta'ala taught us. وَتِلْكَ الْأَيَّامُ نُدَاوِلُهَا بَيْنَ النَّاسِ. These days, we will move it around between people. The only question I'll say to everybody, are we ready? If Allah subhanahu wa ta'ala tested us, may Allah never do that, Ya Rabbi Ameen. Because I asked this, I was a little bit different from the rest of the team because I was not able to go to the hospital, OBGYN. It's a different hospital for safety, for about 4 days. Actually, almost 5. So I speak Arabic, walillah alhamd, so I was able to talk to people probably more than they did. When I spoke to people, as if Allah prepared them for this. when you as a child live in Gaza, living in Gaza before the war, doesn't know what chocolate mean, doesn't know what ice cream mean, and don't talk to me about iPhone 13 and 14. And I always wonder what makes them upset, what makes us upset here. So when this came in, I wouldn't say ready, nobody ever will be ready for what we saw. And we didn't go to the north, by the way. They didn't let us, it's not safe. But they were ready because when I spoke to one of the ladies, and I put it on my social media, she said, I lived all my life for my akhirah. This is a 38-year-old lady, looked like educated, of course displaced from the north. So the way you prepare as a medical student is, prepare how will you serve Allah subhanahu wa ta'ala in your career. Keep doing this, and I will end up with this. I never felt OBGYN is something as pleasing to Allah as I want it to be, because as physicians, and many physicians in this room, inshallah you'll agree with me, it's a job and a profession that gives us a lot in dunya, right? So I can't claim this is all I'm doing it for Allah, except when I went to Gaza. That's the only time where I felt, you know what, my life is in jeopardy, everything else in jeopardy. I could be this girl that the bullet comes to my hand and who cares, right? So do what pleases Allah and keep asking Him to use you. Maybe not in Gaza, maybe somewhere else, maybe here, it doesn't matter. Because at the end, what do you want and what do we want? We want to please Him. The way He wants us, not the way we want. I'm sorry? You can check it on the news. We were in Gaza.
Assalamu alaikum. So from the discussion, I think I understand, Doctora, you help actually women, right? OBGYN. So, and I don't hear a lot of discussions actually even between us about the suffering of the women in Gaza. We hear like in the news in general, but maybe you can shed some light on, like I'm sure they go through a lot of stuff in terms of hygiene, in terms of,
beautiful. This is actually the first time someone is specifically asking about the woman, and may Allah reward you. I became much stronger after talking to the woman of Gaza. By Allah, and He's my witness, and I'm in His house, there's not a single woman who complained. And just to add to this statement, there's not a single woman who I talked to did not lose a member of her family. Could be a husband, a son, more than that. The woman that the fourth daughter, I met the mother. The only thing she was talking to me in Arabic, tell them not to cut my daughter's leg. They are people of amazing strength. The woman who I told her story where she was in the north, moved 3 places. She was in a Shifa hospital during the attack. And then finally the soldier told her, take your son and go on the Bahr, on the way of Bahr, meaning go south. She said, where? He told her, just move along the sea. In the middle of the night, in December, very cold, she was barefooted with her son, 11 years old, and much worse story. I asked her at the end, and I said, how can you teach me as a woman, how can you do that? That was her answer. All my life, and this is to the sisters before the brothers, all my life, I lived for 2 things. I have it recorded, it's on my social media, and even we translated. I lived for my akhirah, and I lived to teach, and me and my husband, to feed my children with halal. She looked at me in the eyes and she says, this dunya is done, how long are we gonna live? Then she looked at my eyes and she said, I think you have Quran in your face. I'll see you in Jannah. I was speechless. Those were the women. And the picture that Dr. Elvi put there, that woman, I spoke to her, lived at the entrance of the hospital on a mattress. The brothers absolutely saw her because she was next to their entrance, to their place, and where they stayed and where we prayed. She said, I've been on this mattress for the last from December. We were there in April. Next to her is her daughter. Where is your husband and your son? In the north, I don't know. What are you eating? Whatever they give us. Where do you go for bathroom with the patients? Not a single word of complaint. Those are the women I met. Subhanallah.
It's important to note that where she was staying, she says it was a resort compared to what she had up north.
Assalamu alaikum wa rahmatullahi wa barakatuh. Before I add a little bit more regarding women's strength in Gaza, subhanAllah, I first wanted to thank the community here. As Sheikh Ubair mentioned, I'm from this community, and I know that there are many individuals here who made dua for me personally when I was gone, and for that, jazakumullahu khairan. I will always appreciate that. I'm a pediatric critical care doctor, so by training I work and I take care of children. But my specific job when I went to Gaza was to work in a neonatal ICU or a NICU. And this is an area in which preterm babies are born, those children that are born earlier than when they should have, or newborn babies. And because of that, just because of my line of work, I also had a chance to interact with many of the new mothers there. For the ones that were still alive and had survived. Specifically, I went out into the tents and we were told, our group specifically was told to make sure you bring lots of feminine hygiene products as they were in scarce supply. So we asked them, how it's been months, how have you guys been surviving? And I met a woman and she said that, you see our tent, you see how there's holes here in this tent. We've cut pieces of this tent out and we've been utilizing that as a feminine hygiene product. So you can imagine how uncomfortable that may be, how unhygienic that may be, and the risk for infection was very high. Regarding these new mothers, many of them first-time mothers, many of them have had many children in the past. I spoke to a couple who had been waiting 12 years for their child to be born. And their child was born during the time of the bombing, and unfortunately had passed away. So after 12 years of trying, her and her husband, unfortunately, their child had passed away from a disease that is very simple. It's a disease that we treat with caffeine, the same caffeine that you and I drink here every day with our tea and our coffee and our soft drinks. This child just needed caffeine, and unfortunately, caffeine was in short supply, and this young, beautiful child had passed away. So, the strength that the women have, subhanAllah, and the resiliency that they have sets the tone for the rest of the ummah. The things that they've gone through, we've heard countless stories of women in the north who had delivered, and within 30 minutes after delivering a child, were now taking that child and walking down to the south to Rafah. So, I'll leave it at that.
Assalamu alaikum. My question is that while you are in Gaza, before you leave, what do you notice that about water, food, medical supplies, and once that the youngster been treated when they lost their parents, what happened to them after they got treated? Jazakallah.
So I'll let my colleagues here answer many of those questions. Just one comment that I'll make specifically regarding the orphans. So subhanAllah, there are many stories of what I like to call flowers growing through the rubble. So one such example is, I was working in the largest neonatal ICU in all of Gaza, which was quite small by American standards, but it was the largest functioning neonatal ICU at the time. And one day, these two young women entered into the ICU, and they had smiles on their faces, and they asked us, "Are there any orphans here? We're here to adopt them." So subhanAllah, like I said, the women of Gaza, subhanAllah, they're of a different breed. So despite all the bombing, despite the lack of food and the lack of family support, you do have individuals, the angels of Allah subhanahu wa ta'ala, what I like to describe, who are out there, and they continue to do good work, and they were there and ready to adopt these orphans and take care of them by the means, Allahu Alam, only Allah subhanahu wa ta'ala knows what kind of means they had and what was available to them.
If I just may add to that, because I actually asked this question, the person who is taking care of the, let's say, social service of the hospital, I asked him when he showed me literally that much stack of names of orphans, I said, how can we adopt? I'm sure I'm gonna go back and there's a lot of people who wants to adopt orphans, especially here. And he answered amazingly. He said, this is gonna be difficult. So I thought difficult because of logistics. He said, no, the people of Gaza will not, they're gonna find it very difficult to send their child. I'm not talking about parents, I'm talking about their child, meaning the community, to send it abroad to be raised by somebody else. So he said, this is gonna be tough, but probably sponsoring them will be much easier. They have a sense of community that we are all aspiring and working on. They do. I mean, we saw a lot of orphans. Remember the 8-year-old, the young boy who was also on social media. They live in the hospital. They live in the hospital. They are alone. 8-year-old was wearing scrubs. I see him day and night wearing scrubs, pushing patients' beds. The day we were leaving, I was like, I'm going to talk to this young man. Who are you? I can't remember his name. Do you remember his name? The one with the scrubs, the boy? SubhanAllah. Zakaria. And I said, what are you doing here? Right? And he answers you, a young man. You know, I was like, what is this woman asking me? And he said, I work here in this way. And he's 8 years old and a tiny 8-year-old, a little bit on the chubby side. And I said, what do you do? And he said, I push the patients' beds because I want to be an orthopedic surgeon. Then I was told that he has lost everybody and he lives alone in that hospital. SubhanAllah.
I want to say something that, you know, every time we do these talks, not one is the same. And something that was shed light to me yesterday, and maybe all my colleagues would agree on this, is that when we were leaving Gaza, it was evident to me how many young kids were in the street running around. And the taxis, for example, they're donkeys, and it's run by 6, 7, 8-year-old. We were driving in an ambulance to the border, and that was, you'll see 3 or 4-year-old kids running around the street. So I know personally I couldn't let my kid do that. I know, so, you know, the level of maturity these kids have is a 3 or 4-year-old kid in Gaza. There's like a multiplier effect there, I swear. And where a 3 or 4-year-old kid over there is like a 16-year-old teenager here. In terms of maturity, in terms of courage, in terms of steadfastness and the ability to withstand what's being thrown at them from every conceivable angle. And you know, it gives you the courage. Yeah, people ask me all the time, were you scared? How was it difficult? No. When you see kids like that in the street, how can I be scared? Why would I be scared? And I see a 3-year-old running around the street selling napkins or selling water or delivering water or bringing water to her family, to the tent. So, I mean, that's where you get all the courage. And you see it. You see the courageous people of Gaza. They're heroes.
Assalamu alaikum. Yeah, so I know this was a medical mission, and Jazakallah khair, may Allah reward you guys for what you have done. Other than medical mission, like if I'm thinking from a perspective of what we know about, there's no education system currently in Gaza, right? There are no universities, there's no schools. Are there any programs going on to kind of, for the kids to focus, or something that we can support from here? I know they do have internet access or something, so is there anything that we could do from here for the students specifically?
Jazakallah khair. You're all asking questions I asked them actually. The last day I was leaving, I mean, the amount of destruction, and we were not in the north, you have to know. The north is where the main thing happened. So I actually asked him, and he said, Doctora, and this was the day before Eid, because we left the day before Eid from the hospital to the south. He said, if today the war stops, and you're gonna bring every available heavy equipments in this world to Gaza. And they will work 24 hours. It will take 2 years to remove the rubbles. And it will take afterwards another 5 years to build back. So immediately I asked, what will happen not only to the children, because we met medical students, residents, and of course children. You know what he answered me? It's amazing. He said, how did we do it when it was COVID? Subhanallah. And he said, we did it online. We will do it online till Allah give us a place. This is the answer I heard from them. And don't ask me how they will do it, but I can assure you, by Allah's grace, they will be able to do it, if they will allow them to live. And this is one of the reasons they want to take them out. You all have to ask, why do they want to invade Rafah? Just to take them out, done. They don't deserve to live. That's how they look at them. Subhanallah.
One thing I want to add to that, though, is, you know, like she mentioned, the colleges, the med schools, everything's been destroyed. So for me, I'm thinking like 5-10 years down the road, you know, all their current medical students and residents, they have to leave the country to finish their training. So there's gonna be this mass exodus of healthcare professionals from Gaza. So it really makes me question, like, what are they gonna do in the next, 5-10 years? It's just, there's gonna be a lot of rebuilding. And like you said, it's gonna take a long time.
I do want to add, while they are not getting the formal education, they are also getting a lot of Quran memorization. They have, everybody I met was a student of the Quran. That's an understatement. They live it. So they might not be very good at calculus, but they have excellent memorization skills. They are great reciters, and they are people of Iman. And they are very literate. And I think Dr. Haifa mentioned it yesterday that 80%, you said?
They have the highest literacy rate in the Middle East.
They have the highest literacy rate in the Middle East. And they have the highest per capita Quran huffaz per capita. I mean, you can't beat that. Another question?
Assalamu alaikum. Thank you, doctors, for everything you've done. Jazakallah khair, and thank you for coming to share your experiences. My question is, do you think, or inshallah there is, but how do you think that the people in Gaza can recover from all the psychological trauma that they've experienced and are currently experiencing?
Another question I asked, actually. You know what was their answer? We don't have time to mourn our dead people, to think about our mental health. One thing I have no doubt in it, because the mental trauma, and we lived only 8 days. There was 2 days of travel. We were only 8 days, and we didn't see something falling on our head, and we didn't see any of our member of family dead. It took me 2.5 days to be able to talk to somebody after I came back. Honestly, I couldn't see any human being. Everything felt no value. So you can imagine for them, and we were only 8 days. The difference is, which I've said it in the beginning, and now, until Allah subhanahu wa ta'ala allows, their faith reminded me of Sahaba, the stories we hear and we learn when you hear that they are in the battlefield, carrying the flag, he dies, the next person jumps, carry, and he dies, and you wonder, what is these people? That's who we saw in them. Allah subhanahu wa ta'ala will take care of them, not for any reason other than, and again, this is my feelings, because they are attached to Him. And Allah is able. That doesn't mean there is not going to be a lot of trauma. But it's not going to be the trauma that you and me will feel. They are not mutrafuna fil ard. They are not the people who lives in luxury even before the war. It's a very different, they are different human beings. This is how I will say it. Just to say about the children, to give you an idea, the last day before we left, there was a little bit more food entered Gaza because of what happened to the World Kitchen. So, and they are extremely generous people. We haven't seen meat. They haven't seen meat for months. You have to come to our house and break iftar with us. So we went. And the woman, I don't know where and how, she cooked an amazing meal with chicken. Her son, and the brothers were invited the day before. Her son, Muhammad, 11 years old. And Muhammad have moved. His father is the chief of the outpatient department and orthopedic surgeon. So they are well-to-do people. And they moved 3 places till he ended up, family of 7, in one exam room. I was there, 1 bathroom, and then another exam room. If men comes in, they go. So Maghrib time comes in. Did the mother look at the son and says, Muhammad, it's Maghrib time? Did Muhammad says, oh, I don't have wudu, I need to go and do wudu, the usual here? Not a single word. Muhammad stood up. I was there, I prayed behind him. Muhammad stood up, brought all the sajjadas, put it together. He's the imam, and he led us. 11. Even I couldn't tell him, you're not supposed to lead us because you're not a baligh. And I was like, you know what, I'll pray my maghrib later. But it's amazing. Then his 3 sisters wanted to give me a gift. These people living under attacks. They brought a box of chocolate. And I said, wow, chocolate in Gaza. No, this is me. They opened the box, and there was all these different color of beads. So the girls, and they said, we're going to give you a bracelet. I was like, how are you going to do it? They went and get a rubber band, and I don't know how they did it, and they gave me the bracelet. It was taking a lot of time, and some bombing started. It was night, and they all told us, don't walk at all outside, which not outside, from one building to the other. So I looked at Muhammad, teasing him, and I said, Muhammad, come and help your sisters. He gave me the look, and he said, this is girl's job. I had nothing to say, 11-year-old. And I asked him a question, I can't tell you the answer, but the answer was, don't worry about them. This is how I said to myself.
In need to answer all your questions, we're going to move the Iqama time to 9:30, inshallah. Okay.
Assalamu alaikum. So my question is, since October, we've been seeing a lot. And of course, you were there. Seeing from here is different than being there firsthand. But we are finding it difficult how to cope with it and how to take what we are seeing in a constructive way to better us than going into, let's say, hopelessness or depression or things like that. So how do you cope with what you have seen and how to get better from what you have seen?
Personally, one of the main drivers for me to go there was after I saw what I saw, and I just felt really helpless, very depressed, very sad, and sitting in my room by myself crying at night. And then the opportunity knocked, and I jumped on it. And since I've been back, I've had survivor's guilt and we all have. I can tell you, right, all of us here in these tables, we all have survivor's guilt. And why us? Why am I here staying in Corona and not scared? And we have that. We all go through it. And how you go through it is by telling their story every day, no matter what. You educate non-Muslims. You speak about them. You share their stories. You send links. You post. You talk. You get people to jump on your side. It's very hard to say how you deal with it because you really don't. Because I know they are going through something a lot more worse than I can ever go through. But they also give you the courage to keep on fighting, striving for better or whatever. They guide you that way. One thing I always tell everybody, we all went there with the intention to help them, help Gaza, help whatever way we can. No way have I ever imagined that I feel that they helped me more than anything. I came back a better person, better human, better Muslim. I had the best Ramadan of my life. My life. I never prayed Qiyam every single night in the last 10 days. It's not something I'm proud of, but it happened in Gaza. When we left, when we got in the ambulance to leave, I couldn't stop crying. And then I looked out the window and they were crying that we were leaving, because they said we were the first group that had a positive impact on them, and they were able to see that there are good people in America, that there are good Muslims. And I want to share this real quick story. Prior to us staying in the first 20 days of Ramadan, Imam Abdullah was praying by himself in that prayer quarters, if you call it. And we got there, and me, Jawad, Dr. Athar, Israr, and Shadman, and then Dr. Haifa Yunus and Dr. Hina, they joined us, and then everybody else started joining us, because they saw these foreigners are here, they're interacting with us, they are good Muslims, they are on our side. They tell me in Arabic, you guys revitalized our iman. And I'm like, it's the opposite way. You guys are helping us. You go there to help them, and they end up helping you. That's the people of Gaza. They are the most generous, they are the most giving people you'll ever meet in your life. And if you're a medical professional, do yourself a favor, do your iman a favor, and find a way to get to Gaza.
One thing I'd like to add is, in terms of like, how do you not fall into despair? I think you just see the people there, they're not, they're still very hopeful. They have absolute, rock solid, firm belief and trust that victory will come, and they know victory comes from Allah. They all say, we will win this war. They have zero doubt about that. So that, just seeing that from them, it made me realize, why would I be depressed about this? These guys, they think they're winning no matter what. Victory or martyrdom, both are victory to them, So when you just see it from their perspective, and you just see that they have 100%, trust in Allah that they will obtain victory, it's hard not to be hopeful with them, And one thing we got from one of the conversations with Dr. Khalil, and this kind of goes back to the other brother's question about what is Saudi Arabia and all these other countries doing? They're helping, but they're helping Israel. The Egyptians are helping Israel, Saudi Arabia is helping Israel, everyone's helping Israel. But the people of Gaza, they've been under siege since 2005, and they told us that changed them for the better. That if this war would have happened in 2004, a lot of them might have left Gaza, But being under siege, not being able to leave, not getting things in, can't get things out, they became resourceful, but they also saw that nobody was coming to their help. No other Muslim countries were coming to their help. So I think that really just cemented in their mind that the only help we have is from God, And you just see that in how they interact with everybody, and just how they perceive this war. That they know that the only help is from Allah, and that they only rely on Allah. So that's why they are hopeful, because they believe just being hopeful is an active belief that they know Allah will help them.
If I might add two things. I asked them, what do you want from us when we go back? And I asked more than one person. Talk about us. Tell them who we are. Don't forget us, because nobody else remembers us. And this is why, subhanAllah, and Allah again answered their request, because many of these we did not plan. We're just getting these invitations and we're just saying yes, yes, alhamdulillah. The other thing, which is, alhamdulillah, this is the first time I say it because I just remembered it. There's a physician who we all met. He's actually a second-year orthopedic resident, and his name is Khalil. This man, if Allah subhanahu wa ta'ala will allow him to live outside Gaza, he probably one day may be the Nobel Prize winner. He's an amazing thinker. So I asked him this question. And I asked, why do you think it's you? You know what was his answer? And they know the Quran, and they know how to quote the Quran. For those of you who know Quran. He said, do you know the verse, وَاصْطَنَعْتُكَ لِنَفْسِي? Does anyone know this verse? It's in Surah Taha. Allah talked to Sayyidina Musa and he said, وَاصْطَنَعْتُكَ لِنَفْسِي, I fashioned you for me. He said, this is the people of Gaza. And when you hear this, don't worry about them. And when I hear this and I come back and I said, he chose me to go and he chose you to live in America, all of us, at least we can speak. At least you can wear this. Many countries, you're not allowed to wear this, the kufi. At least you can go for demonstration. At least you can write, you can comment. Those not only help them, but help us, because you feel you're doing something. The reason we were very upset, and many of you, and I was, when I was in Mecca in Ramadan, and I said, what I'm doing in Mecca? And they are dying. But once you start doing something for them, in any capability Allah allows you to, you're going to feel much better. Bi-idhnillah.
We have a last question here.
Assalamu alaikum. So I go to a public school and I see the atrocities occurring in Gaza every single day. And my friends and stuff, I don't know if they like know about what's happening or if they don't care. So how can we make like regular people care about what's happening in Gaza?
So, are you sure you're not from Gaza, man? That's a very heavy question. You know, alhamdulillah, we were able to come back with firsthand experiences, pictures that I have personally taken, and all of us have taken personal pictures and stories. I'd be more than happy to share all of my pictures with you. Besides that, you have the courage to, you have the ability to educate yourself as much as you can and learn their arguments and their counter arguments, and you figure out a way to address all of their bullet points. You know, every time you go, you watch the news, they all have a script where they are reading off a script. Boom, 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 boom. But do you condemn Hamas? But do you do this? What about October 7th? I mean, we, as a person that in public school or in the work or whatever, you need to be educated enough to have a solid answer for all those rebuttals that they you know, all these, they try to distort you with a bunch of facts just to get you away from your point. And so educate yourself in the subject matter as much as possible, really know the history, and show them firsthand evidence from people like us.
I was just going to add to that. So are these good friends of yours or just?
Are you okay with losing?
Yeah, maybe find some new friends. But no, but I would say, you know, just kind of going off what Omar said, you know, it can be hard to educate people sometimes, you know. You know, a lot of people, they just have their opinions, and it's really hard to change that. But, you know, people you're close with, like even when it comes to giving da'wah, I think it's so much more effective, like when you have like a relationship with somebody, you know? I feel like it's relationships that really spread Islam, not just facts, you know, just you can't just spit out facts to people and it's gonna change their mind, you know? So if these are close friends of yours, you know, you gotta maintain that relationship, be a good friend to them, and, you know, talk to them about it, you know? And if you really are close friends, I think it's much easier to, you know, for them to see how it affects you and to see your side of things if there is like a real good friendship there, rather than just sitting there trying to like spit out facts, well, 1948 this, 1946 that, you know, so.
I want to say one thing real quick to that. If they're real, since I've been back from Gaza, I have lost more friends than I have made friends. Okay? I'm perfectly okay with that. Perfectly okay. And I've lost friends that I never thought I would lose as friends. But there's a line in the sand that you have to draw, and you have to be okay with it. That's your stance. You know? And just the fact that you know deep down that you're doing the right thing, you will always be a winner, in my opinion.
Okay, I'm sorry, if I just add one thing. Take every opportunity to bring the subject. For example, tomorrow we have a very hard exam. For example, it's a casual talk in schools, right? You think what you heard today, whatever stayed in your mind, which is everything we shared, was not easy. And you say, you know what, yeah, we have a really hard exam, but guess what I heard yesterday? And I was always thinking of the children of Gaza. They will give you this look, because many people, now maybe a little bit better, but a lot of people didn't even know Gaza exists, or where is it? Your job is just to deliver the message, and if they start arguing with you, pull out. Right? If they start to intimidate you, pull out. Your job, as our job, is Allahumma hal ballaght, as Rasul alayhi salatu wasalam said, have I delivered the message? But take every opportunity. For example, you're eating and you say to your friends, oh, we are so lucky. You know what I heard yesterday? You know my point? Just grab the opportunity, and before you speak, I always do that in general, not because of Gaza. I always ask Allah subhanahu wa ta'ala to make me say what pleases Him. And He will put the words in your mouth, inshallah.
And I just need to add one thing. So like Omar mentioned, you lost how many members at your gym? 20%. He lost 20% of his members. But,
That's exactly what I
but one of his members became Muslim because of the trip, you know? And I mean, have you ever sat with him and told him all these facts about? No, it's from the relationship and just seeing what Omar did that he brought him to Islam, and that is worth more than the world, you know, so.
And if you ask me, would I do it again? What do you think I'm going to answer?
Okay, so first and foremost, Jazakumullah khair. We have a few minutes, 10 minutes. We'll give it down. We don't want to rush our speakers, mashallah, and I think the whole Jama'ah is here. So we have one more question from the sister. My question to Sheikha is how we as mothers staying at home cope with the pain that we see of the mothers who lost their children. Inshallah, if you can add to that.
It's whether you're a woman looking at a woman lost her child, a father lost his child, you're a young man, or a young boy and lost the father, it's the same pain. It's just different kind, but it's the same pain, so it doesn't matter. The same thing. What should I do? Number one, don't forget them. Number two, make dua for them. Number three, be grateful to what we have. All of us. You're staying home, mom. Alhamdulillah, you have someone who takes care of you. Alhamdulillah, your child is alive. Alhamdulillah, your husband is alive. Alhamdulillah, your wife. Being grateful to Allah will chain our, as they say, قيدوا النعم بالشكر. Chain your bounties by being grateful. And don't get numb to it. Don't get numb to it. You know, I attended the class today, and then tomorrow I'm feeling, and then Tuesday life goes back. No, don't get numb to it. That's why we really need to keep seeing the pictures. Maybe it's painful, but keep seeing it, because we need to get to be reminded. And Allah subhanahu wa ta'ala, as I said in the beginning, you never know, maybe when you're feeling down and you're really making this sincere dua, that you will be the reason that Allah subhanahu wa ta'ala will open a way, that Allah send angels as He sent it to the Sahaba of Badr. Allah is capable of doing anything He wants, subhanahu.
Can I just add to that? It's not the. I want to just piggyback off because I really reminded something, and I want to make sure I say it before the night's over. The real people come up to me and say we're heroes. I don't see it as a hero, honestly. I just see it as me doing my part and trying to be a good Muslim. But what I do think is very notable is, and it really came up today when my discussion with my sister, my sister-in-law has family in Chino, and we just came back from Chino. The real heroes are the significant others that stayed behind and bear that weight. I know in my family, my mother saw me go. She saw her son go, or my other brother go, twice. It's something that when you're there, you're not feeling the fear because you're around other people who are fearless. But your significant other here, your mom and dad or your parents, they are worried sick the entire time. So I personally want to just take a second to really acknowledge them and tell them thank you for your hard work and your dedication to us, and thanking everybody who made dua for us. But you know, their effort is, in my opinion, and inshallah, is rewarded as equal. because they allowed us to go and they allowed us to do that deed, and they should also be compensated for that as well, because they did suffer and they were worried sick nonstop.
Jazakallah khair. Last two questions, and you guys can add on as well. Just excuse me. So one is, what makes them really happy when they hear, things? What makes them the most happiest when they hear it? And the last thing is, how can we? You've seen the donations go through. You've seen what's coming in, what's not. What's the best organization or something online that's there that we can donate with? Jazakallah khair.
What made them happy? We go by the ages. Children. What made them happy? We gave them the gloves that we didn't use as we were leaving, or if we used, we washed and gave it to them. They blew it and became a balloon. And they were jumping. Subhanallah, it's so sad for us, because how many balloons we have. And for them, they were jumping. Everybody was calling everybody, playing with them. That's number one. For donations, we took with us, walillah alhamd, so if you know a group going, reach out to them. Alhamdulillah, the group entered on Friday, they were able to. And usually there is and there's people there, we send them the numbers, they reach out to them and reach. Third one, as I said, and I will send you, once I look at my phone, the name of the organization, because even they send me receipts that they really received the money. Exactly, but I just have to check. And inshallah, whatever else Allah opens, keep asking Allah to open doors. And He will open it, subhanAllah.
Assalamu alaikum. Actually, I was trying to say, Dr. Arham was answering something before somebody took over the question and diverted. I wanted him to get a chance to answer that. And also, I want to add something after he's done.
Jazakallah khair, sister. I really appreciate it. My question was a follow-up. I heard a child ask, how do they speak to their peers? Is that right? Who asked that question? And how old are you? 14, mashallah. So I'm a pediatrician, so I feel well qualified to answer this question. Is your question, how do you bring it up to your friends who know nothing about Palestine? Or is your question, how do you bring it up to people who are against Palestine? Both, okay. So I think the best way to bring it up, as many of my colleagues have mentioned, is one day bring up to them, did you know that there's other children who are not allowed to have chocolate? They have no access to chocolate. And see what that brings up, right? No chocolate, no ice cream. Did you know that this is an entire nation of people who are unable to collect the rainwater to drink it or to clean with it? And I think that's a good way to bring it up, because these are basic things that we take for granted, one. And also, these are things that seem natural, right? It seems only natural that if it's raining outside that you should be able to collect it. So when you bring up these things to them, it will put in their minds the suffering of the people of Palestine, right? And how unjust everyone has been, and how the world has turned a blind eye. And just, I know since we're closing our remarks here, I do like to share one story, if I could, and that's of the first child that I met when I was in Gaza. This is a healthy child, and his name is Kanan, and he's a 10-year-old boy. And I had a chance to introduce myself to him. He told me his name and how old he was. And I told Kanan, Kanan, I have a 7-year-old boy at home here in Southern California, and his name is Musa. And Kanan looks up at me, and he goes, oh, that's so cute. May Allah subhanahu wa ta'ala protect him and preserve him.
Allahu Akbar.
So imagine Kanan, while he's saying this, there's bombs going on in the background. So Kanan tells me, says this to me, and I'm thinking to myself, oh Kanan, like how you're making dua for my son who's sitting safely in sunny California, yet you have all this going on. So I couldn't hold myself back, so I went to go give Kanan a big hug. And as I was giving him a hug, Kanan looks up at me and he goes, oh doctor, you hugged me just like my father. Can you continue to hug me? Because I haven't seen him in 5 months. So I share this story because, as Dr. Alvi was mentioning, there are many Kanans, there's many Razans, there's many Zakariyas, and so on and so forth. And if you're ever finding difficulty here and the comfort of the U.S. bringing up these difficult topics to your peers, to your colleagues. Think of Garat. Think of him, think of his father, think of his entire family.
Yeah, I just wanted to add one more thing about helping out. He was asking how to help out different things, although haven't gone to Gaza, I'm a physician. And all of you know with your insurances, this is not covered, that is not covered, you need prior auth, you need this, you need that. All the time you have this roughage, the whole crap health system in America. Now I use this opportunity to tell them, yes, you can get, you're not an Israelite, to get all the benefits. Your money goes to help them, you need to fight. This is what I tell them openly, and some of them are like, they agree with me, they're all non-Muslims. I just openly tell them, yes, we don't get it because we are not from Israel. Americans have to pay our tax dollars to support them, so we cannot get all these things. You have to change your medication. I just tell them that openly now. I'm sorry.
He's been raising his hand.
So I just wanted to ask, I think this is a really important question. Why do you think all of the claimed Muslim countries turn a blind eye to Gaza?
SubhanAllah, all the kids here are probably from Gaza too, I think. I'm firmly believe it. It's sad while they all, yeah. It's sad to say that they are puppets, but we all feel that. But we also saw it firsthand. Imagine us going to Egypt and then getting out of Egypt, going into Gaza, and coming back from Gaza. We're going to a war. We did not see one Israeli person. We didn't see one Israeli government official at the border. They were all monitored by cameras, like from every angle, but they are all puppets. They are paying off all of the government agencies in all the surrounding areas. You know, it's sad, but it is what it is.
I see the sadness in your eyes here, but don't lose hope in the rahmah of Allah. One thing. And number two is, Dr. Haifa has a couple of books outside, Builders of a Nation and Sins, the Poison of Heart. So you can buy it and get some of our thoughts in there. Do we want to continue? Where is Brother Athar? Let's have one more quick question.
You want to continue?
I can stay here all night.
Can I add one thing to your amazing question? Two things. It's not new. We need to learn from history. Even at the time of Rasul alayhi salatu wasalam, and he was between them. There were Muslims who betrayed him. There were Muslims who didn't support him, and there were Muslims who not only not supported him, but they hurt him. So what we see people are doing should not affect us, does not make us lose hope. And if they did it to Rasul alayhi salatu wasalam, and when you talk to the people of Gaza, this doesn't come up except the last day. And I can record it. It was a woman after Eid Salah. We prayed Eid Salah in Gaza. It was the best Eid Salah I've ever did. Every Eid I am in Mecca. And you can imagine praying in Mecca. La wallahi, nothing like that day. And the masjid was old, but it's something similar to this. And these windows were actually bombed, so they were open. One woman came out at the end, and somebody was interviewing her. And you can imagine, I don't know if she lost somebody, but what she was saying, and she was in tears and very emotional. And she said, what kind of Eid? Look at our children. They cannot even have a new thing to wear, which is a big thing in the Arab world. Like I grew up, always the day of Eid, there's something new my parents will buy me. And in our home, they put it under my pillow. And she said, they cannot even buy this. Then she made a dua. And subhanallah, yani, dua al-madloom mustajab, when the person is under injustice and made a dua sincere, it's granted. And I know Allah heard her. And she said the following, and I have it on social media. Ya Allah, everyone who did this to us, who helped them to do this, who didn't do anything to help us, let them carry their children dead, in pieces, in their hand like we did. Subhanallah. So don't despair from the mercy of Allah. Allah, if we are, please forgive me, human beings, feeling this way, what is Allah saying? And He's seeing this. But He has a wisdom. And there's a hikmah why He's allowing this to continue and not interfering at this moment. And what He wants from us is keep going. Don't despair. Feel sad is good, because feeling sad makes us do something, but never despair. And never despair from the victory of Allah. The timing is not mine and yours. The timing is His timing. Subhanah.
Barakallahu lakum. So here's one thing. We will, inshallah, we can continue right after Isha, because the Isha time is there. We did announce it, and we have to go by that time. So inshallah, we'll do the Jama'ah after the Isha Jama'ah. If brothers and sisters have questions, we have our panelists. We can continue as long as we like. There's no time limit, but we do have to stop for Isha, inshallah. So we'll have the adhan, we'll begin in about 2-3 minutes. And then inshallah we can continue. If everyone is here, please do join us for dinner as well. Jazakumullahu khairan. Assalamu alaikum.
Allahu Akbar, Allahu Akbar. Allahu Akbar, Allahu Akbar. Ashhadu an la ilaha illallah. Ashhadu an la ilaha illallah. أشهد أن محمدًا رسول الله. أشهد أن محمدًا رسول الله. حي على الصلاة. حي على الصلاة. حي على الفلاح. حي على الفلاح. الله أكبر، الله أكبر. لا إله إلا الله. الله أكبر، الله أكبر. أشهد أن لا إله إلا الله. أشهد أن محمدا رسول الله. حي على الصلاة. حي على الفلاح. قد قامت الصلاة، قد قامت الصلاة. الله أكبر، الله أكبر. لا إله إلا الله.
لا إله إلا الله. استقيموا واعتدلوا. الله أكبر. الحمد لله رب العالمين الرحمن الرحيم مالك يوم الدين إياك نعبد وإياك نستعين اهدنا الصراط المستقيم صراط الذين أنعمت عليهم غير المغضوب عليهم ولا الضالين والضحى والليل إذا سجى ما ودعك ربك وما قلى وللآخرة خير لك من الأولى ولسوف يعطيك ربك فترضى ألم يجدك يتيما فآوى ووجدك ضالا فهدى ووجدك عائلا فأغنى فأما اليتيم فلا تقهر وأما السائل فلا تنهر وأما بنعمة ربك فحدث. الله أكبر. سمع الله لمن حمده. الله أكبر. الله أكبر. الله أكبر. الله أكبر. الحمد لله رب العالمين الرحمن الرحيم مالك يوم الدين إياك نعبد وإياك نستعين اهدنا الصراط المستقيم صراط الذين أنعمت عليهم غير المغضوب عليهم ولا الضالين آمين. ألم نشرح لك صدرك ووضعنا عنك وزرك الذي أنقض ظهرك ورفعنا لك ذكرك فإن مع العسر يسرا إن مع العسر يسرا فإذا فرغت فانصب وإلى ربك فارغب. الله أكبر. سمع الله لمن حمده. الله أكبر. الله أكبر. الله أكبر. الله أكبر. الله أكبر. الله أكبر. سمع الله لمن حمده. الله أكبر. الله أكبر. الله أكبر. الله أكبر. الله أكبر. سمع الله لمن حمده الله أكبر الله أكبر الله أكبر الله أكبر السلام عليكم ورحمة الله السلام عليكم ورحمة الله الله أكبر استغفر الله استغفر الله استغفر الله اللهم أنت السلام ومنك السلام تبارك السلام عليكم ورحمة الله. First and foremost, a very great thank you and jazakumullah khairan to all of our guests for tonight, our speakers. Inshallah, this is not the last time. We'll definitely see them very soon for our different programs. We'd like to thank them for their time. Again, we still have tables here, and if they have more time, or it's up to them, if anybody has any questions, they're still here. Please do ask them, inshallah. Please don't forget, tomorrow we have our protest at McKinley from 3:30 to 5:30. We need numbers. We need you to show up, please. Jazakumullah khair everyone for coming. May Allah subhanahu wa ta'ala allow us to see success and grant us victory, inshallah. Ameen. Please do not leave without having dinner. It's outside, inshallah. And Jazakumullah khair. Assalamu alaikum.